Good afternoon. My name is Corina Herrera Loera. I'm the Public Information Officer at the Emergency Operations Center here for the Santa Clara County Public Health Department. I want to welcome you all today. We will have a guest here from Santa Clara County Office of Education, but before I introduce him, I do want to give an update as to our current numbers and information and updates for our county in general. We have Gloria Pacheco, who's going to be helping us with our presentation in the background. Thank you so much, Gloria. And we'll be streaming that shortly. Thank you so much. Next slide, please. So these are our daily updates. 82.9% of our residents of all ages have been vaccinated, and our 7-day rolling average of new cases is 4,851. As we all know, because I think we all know somebody who's tested positive recently, or maybe tested positive ourselves, our numbers are continuing to stay at a high rate. But we also see somewhat of a place that we're evening out, and hopefully we just go down from here. Thank you all for continuing to mask up, get vaccinated, and boost it up when it's your turn. Next slide, please. And so just reminders in regards to mask do's and don'ts. So wearing a mask do's, surgical masks are the ones that is what we're recommending the most. Double masking if you don't have the surgical mask, and making sure that they're tight fitting around your nose and your chin. And do pick a mask that completely covers, as I mentioned, the nose, your mouth, and snugly without gaps, and has a nose wire to prevent any air from leaking out of the top of the mask. In regards to mask wearing don'ts, don't wear a single cloth mask, and mask with an exhaust valve or vents. So don't use those. And ensure again that they're not under the nose, that you're able to make sure that it's covered. Just don't go out there without a mask, and ensure that if you don't have the options of wearing any of the first 3 masks, double mask, and or just stay at home or in a place where you're not with other folks who you don't live with. Next slide, please. And in regards to vaccine cards, I know many of us who've gotten vaccinated over time may have misplaced our cards. So to request a vaccine card, you can either request a vaccine card, the verification from the state, by using any one of these sites, the myvaccinerecord.cdph.ca.gov/ provides immediate results . And so you can get that on our screen here if you want to come back and pause it and write it down, or from that bit.ly /CAIR release. And usually the reports are giving every 2 to 3 weeks or so. So if you've gotten vaccinated more than 3 weeks ago, then your information should be on there. Or number 2, if you were vaccinated at a mass vaccination site or a site run by the County of Santa Clara, you can visit the Expo Hall at the County Fairgrounds through the entrance gate D at 2542 Monterey Road, San Jose, California, 95111. Next slide. Or you can contact the healthcare provider that administered the vaccine, such as Kaiser, any one of the healthcare providers that you might have gone to. Or you can request a COVID-19 vaccine record if you received your vaccine in California in person at Public Health Department Travel Immunization Clinic at the 976 Lenson Avenue, Suite 1100, San Jose, California, 95126. Always best to call ahead and ensure you have the right business hours, etc. And that's at 408-792-5200. Next slide, please. And we encourage everybody to consider getting tested if you had a known exposure to someone with COVID 2 or 5 days ago, especially if you are unvaccinated. You should get a COVID 19 test. Also, if you have any new symptoms such as fatigue, headache, body muscle aches, cough, fever, sore throat, and or congestion. You should also get a COVID 19 test if you have symptoms and are high risk for severe illness because of other medical conditions, age, or have a compromised immune system. You may qualify for treatment to reduce your risk of severe illness. So it's always best to know early on if you are positive for COVID. Next slide, please. And in regards to emergency rooms, given how extremely contagious the Omicron variant is, if you have any symptoms of COVID 19 and cannot get tested, just assume you have it and follow isolation guidelines. And if members in your household are having similar symptoms and at least one of them tested positive for COVID 19, you can probably assume that all members in your household have COVID 19. Um, do not get a PCR test if you have tested positive in the last 90 days. You have already tested positive with a rapid home test, or you need a negative test to end the isolation early. For that, use a rapid home antigen test. If you are quarantining and you need that negative test, make sure that the test that you use at the time that is being said, I think the most recent, because those is changing, is the 6 days. Use the antigen test. And then please do not come to the emergency room if you are only needing a COVID 19 test. And really, it's getting to the point where please do not come to the emergency room only if you need an emergency medical assistance. Um, Otherwise, call your healthcare provider, make appointments to prevent from impacting the emergency rooms even more than they are already. Next slide. And in case your kids feel sick, make a plan in case your child has symptoms of COVID 19. Don't send the children to school if they have any of the following symptoms: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle ache or body ache, headache, new loss of taste or smell, sore throat, nausea or vomiting or diarrhea. And I actually happened to keep my daughter from school today, home with some muscle ache and a slight fever. Um, so yeah, just to be safe and ensure that we get time to test so that we don't pass it on to others. Next slide, please. And so just phone numbers to have handy, the vaccination call center, 408-970-2999. Know your rights in the workplace, 1-866-870-7725. Mental health services, 1-800-704-0900. COVID support line, 408-808-7770. The call center, 211, which is an easy number to remember. If you remember any of these, you can call the call center at 211 and they can guide you to any number needed. Or you can also send a text message to COVID saying COVID-19 to 211-211. We also have the crisis hotline that's 24 hours, 7 days a week, and that's at 1-855-278-4204, or text renew to 741-741. It is tough times for us all still. Some of us um, have been dealing with this for a long time. We never know when we might need these resources, or a family member or a neighbor. So it's always best to have these numbers handy in case you need them. So I'll leave that a couple seconds longer so you can write them down, or you can come back and pause the video as well. Thank you so much, Gloria. Now we're going to introduce our guest speaker for the day. We have Dr. David Putney here with us from the Santa Clara County Office of Education. And I'm getting an echo, so I'm going to go ahead and turn my mic off, David, and pass it over to you. Welcome.
Great. Thank you so much for this opportunity to come help support the greater conversation throughout Santa Clara County. as you know, I just want to acknowledge that this is a very challenging time with the increased transmission with Omicron, and just to assure you that Public Health, California Department of Public Health, has been working tirelessly to update the guidance, and it has changed quite a bit in just the last couple of weeks due to all the updates and changes that have occurred. And so, as the general public, just want to encourage everyone, to do your best to stay informed. When things change, just take a deep breath and reach back out to the areas that you gather information, accurate information. The California Department of Public Health is a great source of accurate information, and our Santa Clara County Public Health Department, we're providing you access to that accurate information. So I want to kind of give an overview of some of the quick changes, and I'm not sure, Karina, if I'm able to share my screen or if you're going to share yours for these links.
I do have the slide that you sent, so I can work on showing that. And
or can I share mine? Because then I might be able to move a little bit.
Try to share it, and I'll
okay, let me
prepare
see if I can share my screen. Sharing screen, okay. Let's see if this works. Okay, is that sharing? It is sharing.
Yes.
Great. Okay, great. Thank you. So that's this screen. Perfect. So I just like to, kind of give a quick overview. I'm going to give a couple quick high-level ways to access direct information from Santa Clara County from California Department of Public Health, and then talk about how the guidelines have changed and answer some questions that we're getting often, and hopefully that'll answer a lot of questions in the greater community around the nuances. So first off, California Department of Public Health provides these general guidelines that we here in Santa Clara County are following. Our Santa Clara County Public Health has identified that we follow the Santa Clara County Public Health, so that's kind of the jurisdictional piece. Local educational agencies are following this guidelines. Now they have the choice to follow these guidelines and also add on additional layers of mitigation. They may have additional requirements that each individual school may add on to the general guidelines. We have public, private, and charter schools here in Santa Clara County. So if some of these information seems like it's less restrictive than what your local school is doing, I just want to remind you that please check in with your local school, your children's school, and ask them to the degree what is really the protocols that they're following.
David,
they can add, yes?
You could put your either, they say, I'm hearing that your audio's low, so we can either put it up or...
All right, let me try. Is that any better?
I think I can hear you better.
Okay, sorry. Okay, thank you. So local schools can add on extra mitigations, just not less. So hopefully you can hear that a little bit better. CDPH gives basic guidelines and schools follow those guidelines, and they can add on additional guidelines if they choose to. So here, when you go to public health, you can click on this banner here. It says, I'm looking for. This will give you a drop-down menu that will give you a lot of wonderful information. The guidance documents here, it's going to give you information around what's been updated in the guidance area. Specifically to education is then these updates here. These updates are nested that show you the name of the document. It shows its original posting and when it was updated. That's important information. If we look at the new guidance for K-12 schools, this then gives you information as to when it was posted and then related guidance documents. Now I know I'm showing you how to get deeper into the information, but it's a good source for individuals that really want to read it themselves. There's been some updates around the practice around responding to a positive case in schools. So basically schools respond to a positive case on campus by identifying the positive case, sending the individual home. They can follow the close contact definition, which was the close of 6 feet or closer for a duration of 15 minutes. And then now the CDPH has expanded that and provided the guidance that schools can also identify individuals in a shared space of 15 minutes. We're seeing that Omicron is transferring faster between individuals, and we're trying to work with schools to be more effective and respond quicker. So in this scenario, schools have the capacity to identify a close contact in a school classroom space. There's the group tracing. This document is nested here, and you can link, these are all linked together. This would then provide you the group tracing approach for students. So schools can follow this guideline here. It talks about recommendations on how a school would follow up in notifying the school community. Schools now can notify the community that there was a positive case on campus, and then students can continue to come to school regardless of vaccination status if they're masked, and they test within a weekly cycle. So this is new information where some schools may be moving to this new scenario to allow individuals to continue to come to school and test on a regular basis. We're also encouraging families to participate and help with that testing, because testing is so important to ensure accurate information. Let's see. There's also in the guidance documents here at the California Department of Public Health, there's new information around isolation and quarantine for COVID-19. That's here. It was updated as of January 8th. This information provides a lot of information specific, but this applies to schools around the status of staying home. This document helps answers a lot of questions of who needs to stay home. All individuals that test positive with COVID-19 are expected to quarantine or to isolate at home. They are able to test out now of a positive COVID test after day 5 if they are asymptomatic and no symptoms, or if they have improving symptoms and no fever within 24 hours. They can test with an antigen test. The antigen test is the test to use because it tests for active infection. If the test comes back negative, they can then return to school or return to work in that setting, as long as they have the negative test on day 5 or after, and it'd be the following day. So if they test on day 5, they would be eligible to return to school on day 6, and they'd be expected to wear a mask around others indoor and encouraged to wear masks at all times. These are the language items that can help remind you of this. Quarantining now has been updated. Individual students that would be exposed in a school setting and are unvaccinated, you can see that this breaks down to 2 bullets, unvaccinated, or individuals that are vaccinated and booster eligible but not yet received their booster dose. So that's they've been grouped together. These individuals would be expected to stay home physically on a quarantine. In this scenario, now this is a little bit different than a school-based setting. This would be in an individual not in a school base. So this is a little bit slightly nuanced here. So, but in terms of a typical setting, this is where individuals would be expected to follow this. In school settings, when there is a close contact, they're able to continue in the school setting and test within a 5-day cadence, as long as they are asymptomatic. And then also persons who are exposed to COVID that are fully boosted or vaccinated but not yet booster eligible would continue to allow to stay in the school setting or any setting and continue to test on day 5 just to ensure that they're not asymptomatic. Additional guidance. I just wanted to give a quick overview of some of the changes as well as the resource on where to find this information in the community. Maybe I'll pause there and see if there are questions, Karina, that you would like me to address.
Great. Thank you so much, David. I'm hoping that my audio's better and that I'm not echoing. I know I got some feedback from the community that I was echoing a little bit, so hopefully we're good now. And of course, I'm having issues with the video, so you can hear me. I'm gonna go to the questions. I've been reading through them. Thank you so much, community, for logging on and listening in to Mr. David Putney here. Today, I'm gonna go through the questions. We have many people that have comments. Thank you so much for participating and your thoughts. Also sharing your own personal experiences. Thank you. I'm going to start with Mr. T. Villarreal Alarcon. And he's wondering, how are you guys going to protect our students? The outbreak is horrible. Why no shutdown in school for a few days or weeks for a deep clean? How are you guys going to deal with this outbreaks at school? So those are the two questions that I read on his statement.
Okay, great question. Um, we are seeing a high surge in our community. Individuals are at greater risk of being exposed and or contracting COVID-19 in their social settings. The research that has been done over the last year specifically has shown that school settings are the safest places for students to be and tend to have less transmission in school settings. Most of the transmission we're seeing in our community is in our community with just typical average behavior in and around the community and in social settings and in eating in congregate settings like family gatherings or barbecues or local events. We're seeing in schools that wearing masks in school settings consistently where staff is supporting and encouraging the safe behaviors, there is significantly less transmission in school settings than in other places in our community. Therefore, we're really working hard to support schools to stay in session. That's the expectation of our state and the California Department of Public Health because it's built on the science that shows that it's safer in school settings. Having students go home to remote learning may sound like a safer way. In most situations, it's not helpful for their social, emotional, mental health. It's not helpful for their learning, and they're safer coming into school setting. Masking in schools, vaccinating in schools on a regular basis really helps. If those that are eligible to vaccinate, helps keep students in school. We are working with schools around if there's high transmission rates and high exposure rates. We're helping support with access to testing and support to encourage the highest volume of testing availability that we have currently. And schools are actually seeing a lot of just what the community is experiencing, a high volume. We anticipate the Omicron spike is leveling out. We anticipate that it should start dropping off in the near future, and that will help us all kind of recalibrate and continue to improve our practices. Karina, you're on mute. I'm sorry.
Thank you, David. Okay, we have Rabavina who's saying, why have school districts decided that in-school close contacts that are wearing masks are not communicated to parents until at least 2/11? And then in there, he also asks, do they not understand that these contacts will spread into all corners of the homes of these kids?
This recent allowance here in Santa Clara County has given schools the allowance to inform school community that there's high transmission in our community and that they wouldn't be notified on every occurrence of a close contact. That is due to the high volume of surge and the volume of communication that would be necessary to continue that is far exceeds the ability to get it out at a timely fashion. There's greater community spread in and around the school as opposed to transmission in schools. So this allows the community to be well informed and understand. This is only a time frame that we anticipate the surge to be ending, hopefully at a much lower level by February 11th. So that way community can understand that, as well as inform the community that we all need to take responsibility to do our best to test our children and test each other on a regular basis to ensure that we haven't been exposed to COVID-19, or more specifically, we haven't contracted COVID-19. We are all being exposed to COVID-19 in and around our community, and this just gives us a chance to focus on really moving quicker, informing families that we need their help also to test. It's not just the school's responsibility to test, it's also the community, the families to test their children regularly.
Thank you so much, David. And we have TV Arral Alarcon again, who is, and I am gonna now put him, why not make it no cloth mask in school if not protecting?
I'm sorry, can you repeat, please?
So It sounds like he's wondering why not make it no cloth mask wear in schools if it's not, if cloth masks are not protecting.
There's layers of protection. The best protection, oftentimes the language is wear the mask that you have. It's better than no mask. It's better to have two masks, to have a surgical mask. You shared this at the front of the presentation today, Karina. A surgical mask covered by, with the metal, covered by a cloth mask gives you very nice protection because it keeps it covered around your face and the exposure areas. The cloth masks brings it closer to your face to keep you safer. The KN95 is shown to be effective. The N95 tends to be the most effective. We do hear conversations at the federal level of getting masks, more masks out to every person in the United States. We have talked about encouraging more mask wearing and double masking. We're supporting that here in Santa Clara County. I think we will learn more about masking going forward as we continue to learn ways to live with COVID. COVID is here, and we need to learn how to be safer and hopefully continue to improve safety practices. So even if a basic cloth mask is not as effective as a dual layer mask, it's better than no mask.
Thank you. In the next questions, there's kind of a group of comments and questions around testing. So the testing requirements at the school, I'm going to start here with Linda Pascual, who's saying, will the weekly testing be a requirement or recommendation for school districts? We also have Sherry, who mentions private schools provide weekly testing for kids there. Why not a public school too? The federal and state has provided funding to schools to keep kids somehow safe at school due to COVID, I thought. And then we have somebody else asking about the testing at the private schools, and doesn't the county support private schools with tests too? So I just wanted to group them so that you had them all together.
Great questions. Testing is a very important part of our mitigation strategies. The state of California is funding private, public, and charter schools to work directly with the California Department of Public Health to provide testing at their schools. We provided, in Santa Clara, we provided this guidance to all the schools, private, public, and charter schools, about the testing program that was available starting in June of 2021. A lot of schools jumped on that opportunity and are working with the state to provide weekly testing. They've been providing surveillance testing and or response testing as necessary. These programs are still available. We're still promoting access to the California Department of Public Health's testing program. So each local district, each local school organization needs to make their own individual decision as to if they're going to participate in that resource. Many school districts also worked with a third-party vendor and worked with their existing funding to work with a provider of testing. Some private schools have done that as well, and some charter schools. I would recommend that you contact your school and find out what vendor and or what system testing they're using. I do know that some schools rely on the community and their parent base to provide testing. Schools are encouraged and recommended to provide testing. It's a general guidelines for them to provide, but now we also see that it's beyond just the school's responsibility. It's also our parents and our community to do our part to test our children being exposed as well. I think testing is a useful and important tool that we will become more aware of the significance and the value of it. And the current guidelines, this weekly testing, it's not just the school, it's also the parents in the community that would also be responsible for their own child and testing. There is a federal testing program for all individuals in the United States at address to get 4 tests sent home. We can put that link in the chat at some point where you can sign up through the federal government to get tests sent home. I do believe that there's been a provision now with healthcare providers to provide reimbursement for tests, over-the-counter testing, as long as it has the UAE, the emergency use authorization, the EUA, FDA approval. In-home over-the-counter tests are now eligible to be used and may be used for isolation and for quarantine in these circumstances, and healthcare providers will reimburse you for those. There's programs to support testing at home. And then there's also the Santa Clara County SECFreetest.org, where we provide it in our local county at multiple locations, the Fairground, South County. We also provide the clearinghouse that lets you know where testing is located across our county, and a calendar to identify times and available points. So testing is really available for everyone, and we all need to take responsibility to provide testing to our family and our loved ones to help everyone be safe in school and out of school.
Thank you, David. And I do have TV Arrela Larcon again, who has the same question, sounds like twice. So I'm going to highlight the most recent one, where he clarifies. So what happens if a student is exposed? Oh, I think that was the first one. How can they get a rapid test if they're hard to come by, since they can't do a PCR because they already had COVID? And then he does. So he's asking about basically how. Yeah, let's go back to that one. What happens if a student is exposed? How can they get a rapid test? And I think you answered it. If you can just repeat it, how maybe somebody can get access to a rapid test if needed.
Great question. Each local school district, I would refer you back to your local school district. Cardia, can you mute? Thank you. The mute, when we're both on, it starts to echo. I encourage you to reach back to your local school district. Some school districts provide testing at their district office, their local school site, depending. So if your school is providing it, that's the easiest place to get a rapid test immediately. Some school districts are not providing that service, so again, you have to check with your local school district. I know that there are vendors that are providing testing you can order online. I know that's difficult. There's also the Santa Clara County SCCFreetest.org website that you can go and find out where the local test is in your area. I encourage you to go to that website often if you need it. It could be hourly updated. I do know from our testing team that when appointments become available or when people don't show up, we recalibrate these available appointment slots, we repopulate the website, and we make those available. We do know that they are coming online every hour, so please check back the SCCFreetest.org location, and you can find out what is available in your local area. And again, refer back to your school district if it's for your child in a school setting. They may have additional resources. They may have home test kits. They may be providing it at their school site.
Thank you, David. Also, I want to let folks know, and we will be posting it soon if we haven't already, is the covidtest.gov, going to covidtests.gov, and the federal government will be providing 4 tests per household, so you can order your test there, and my understanding is they will be starting to be, we will be receiving them at the end of the month of January, so look out for those 2, order your tests if you haven't yet, and we will be having a post on our Facebook, so look out for that if you need the information. Okay, we have Natalie Matheson who's saying, how is the county addressing shortage of tests, delays in results, and lack of reporting at a home positive test? So I know, David, that's a question for me in regards to the county. And as we've seen, the way that, we've been providing information, letting people know, don't go to the emergency rooms, here are other resources in regards to how things are changing. For example, quarantining, the different ways to double check, right, on the 6th day now. If you have access to an antigen test. If you don't have access to it, then do the full 10 days to prevent from further spreading. So as a county, believe me, that we're looking at every corner, every detail, how to least spread it, how to keep those of us who are unvaccinated still safe and getting the resources needed at the emergency rooms, how to keep our children safe at the schools, working with Santa Clara County Office of Education and the needs that change on a daily basis. And meeting, throughout the day. Our daily meetings, looking at the numbers, looking at the shifts, testing the wastewaters. if you can imagine all the details that come and all the people that are involved, it's many of us. And I know, David, you and I sit on a daily meeting every day where, all those updates are given, kind of like a ship, right? We're going to roll this way. This is what we need to do to continue to keep each other safe, our community safe, and ensure that we are providing the adequate resources such as vaccines, tests, and all of those things. If there's if we're running out on this side, why do we have more over here? Changing staff, looking at the needs. So there's so many things that we're doing to address a shortage of tests, delays in results, and lack of reporting. I'm sure, the Kaisers are doing the same. I know a week ago, the wait was a week and a half to get your results. So if you can imagine if you're testing positive, and you have to wait that long, I know they're changing too, or even a week and a half to get a test. I know my daughter, for example, we called today and we were able to get one for tomorrow. So I know we're all looking to see how we can do better to provide better resources. So yeah, thank you so much for participating and being in this community forum today. Let's see, I'm going to go through next questions. I do have a question here from Alexandra. Thank you so much. In regards to the question sent via email, please post your question here. I see that you're able to put it on here. If we haven't addressed it yet, please make sure to post your question here on YouTube. I see you're joining us. Thank you so much. If we have not addressed it yet. So make sure that if we haven't addressed it, if you can post it here. Our plan is to address them, but just in case, we're human and we might have missed one or two. But if you don't see it or if you don't hear it being responded to, please post it on here. Thank you, Alexandra, for joining us. Let's see. Any other questions?
Karina?
Yes.
To add to what the county is doing to support with testing, I think it's important for us to context the rate of the Omicron and how it's impacted all of us. If you look at the data pages that our county provides, I encourage all of you to look at the data pages. It is astronomical increase, and I think even as our county, one of the most affluent counties in our country and in our state, has provided so many resources, the volume was so high that I think it's been this huge surge. Now we're coming off, hopefully this trend continues, will come down, and then our response turnaround time will be faster, access to testing will be faster, and more individuals becoming more self-reliant on the in-home test kits that are FDA approved, because then you can get a rapid test, immediate response within 15 minutes, and then you'll know how to behave in the community if you need to stay home and isolate, or if you just need to monitor for symptoms and quarantine based on your vaccination status.
Thank you, David. And yes, exactly. So my daughter has the symptoms. She's quarantining. I'm quarantining as if we have it until we, get told otherwise. And I know that, it's hard. It's hard to come by those tests. I did see Rob Avina here. I posted it on here. He also mentions about the either getting free insurance, getting reimbursed later, or also the covidtest.gov, making sure you ordered them. So I'll say, make sure you ordered your 4, and if you need additional ones, you can get reimbursed. And we have a question from Karen Vergara, who's wondering, how often should we be testing at home? I have my response, David. I don't know if you, in regards to schools, what you would tell a parent that asks a question like that.
In schools, having the in-home test is wonderful. I would work with your school to see what their testing cadence is, and if your school provides a testing cadence, then I would use your testing to supplement that in the off period of time. If you did weekly in-home testing, would be helpful. If your school provides testing, then you could use your test as a way to coming out of vacations, or if your family travels, or if you've been in a high exposure situation, such as maybe something of a community event, or your child feels a little bit symptomatic, that's when you should be using your in-home test. Again, but work with the resources you have in your community. Check in with your local school to see what they're providing testing, and then how can you use it either as a weekly response if you need to ensure your son or daughter is safe on a regular basis. And if that's in place, then I would use your in-home testing to supplement that, to support that around high-risk times or symptomatic children or symptomatic parents.
Thank you, David. And the only thing I'll add to that is if, usually they come with 2 in 1. So if you or anybody in your household tests positive, consider it a positive. Don't use another one just to kind of reconfirm. I think I've heard that many times, that I tested twice and they both came out positive. If it comes out positive once, it will come out positive again. So just use one, save that other one for another time, or for a family member. You just never know. It was a point where they were really hard to come by. It seems like they're becoming more readily available, at the stores. There was a time where there was none at the shelf, so save them. You just never know when you need them. If
And I'm
you
glad
use
you
one
said-
and it's
Yeah.
positive, it's positive.
And with that, you really can't go fishing for different results. If you tested positive, the California Department of Public Health has recommended that we would follow that as a positive. Here in Santa Clara County, a positive test, we don't overturn it. We would proceed as a positive test. One good example is that when you do your self-administration, you may not have captured enough of the sample on a subsequent test, and actually it's more likely that you'd get a false negative than a false positive on the antigen test. So once you're positive through that duration of your isolation.
Thank you, David. Taking turns on the unmute and mute. Okay, we have Candace Avina, who is wondering, can you please tell me what guidance to follow if we are working in a preschool age program and a child in our program has a brother or a sister that has COVID-19?
Great question. There is guidelines specifically to child care programs on the CDPH's website. We also have it listed on our Santa Clara County COVID-19 page. Basically, in a preschool setting, if one of your children has a sibling that's positive, your child, if they're unvaccinated, and most preschoolers are because it's not currently authorized for the 0 to 5, they would be expected to physically quarantine at home. In that scenario, they should stay home, and through the duration of their siblings' isolation period, they should get tested. The recommendation is get tested on the 5th day of that exposure, and then 5 days after the last exposure. So this is where it becomes unique, in that at home, that their sibling that is positive, if they have a full 10-day isolation period, at the end of that 10-day isolation period, that entire time they were being exposed to their sibling when they were sick. So that your student that's in your preschool would be getting exposed every day their sibling is sick. When their sibling that was positive completes their 10-day isolation period, or their 5-day isolation period, and maybe tests out with a negative antigen test, that would be the point, at that point, where their quarantine, your student's quarantine, would restart, because that would be the last known exposure to a positive person. So that's where it gets a little bit unique and different. So your student, again, would have to wait till that isolation period ended for their sibling. Then they would restart that 5-day period of time, where then they should then quarantine for 5 days, additional 5 days, stay home, and monitor for symptoms. If they become symptomatic at any point, they should test. If they're not symptomatic on that 5th day after the last exposure, they should test again. If the test is negative, at that point, then they would complete that 5th day, and on the 6th day, the guidance would allow them to return back to their preschool or child care program. As long as they would continually wear masks, they would be allowed back. In your situation, I would encourage those families to check in with their preschools to make sure that the preschools are prepared to receive that student back. They can add on additional layers of mitigation if they'd like to. They're just not allowed to layer on less mitigation strategies. So again, the close contact, you have to be quarantining through that entire exposure, and then restart that 5-day quarantine. At the conclusion of that, then they can test, and if they're negative, then they can return back to the preschool setting.
Thank you. We have Linda Pascual, who's saying, so we are not asking districts to make weekly testing a requirement for students? Are we not going to have districts require proof of negative tests?
The guidelines are that students should test weekly. School districts are providing testing. They have the support from CDPH. Some are providing it, some are contracting with other groups, some are not. So these are general guidelines that they are expected to follow. I would encourage you to check back with your local district to see what your district is doing. Right now, the weekly testing is, CDPH is really encouraging a greater responsibility in the community between the school and the parents to participate in weekly testing. Again, the need to test is so high, it far exceeds the school's ability to consistently test everyone. And I think that's what we're moving towards, an individual, more responsibility that we all share to help ensure our students are tested weekly. So again, I would encourage you to reach back to your local district and find out what your district is providing.
Okay. So we have Alexandra B. If my school district has chosen to use a general notice for exposures, how will students who are not part of the on-campus pooled testing unvaccinated know they have a testing requirement?
The general notification encourages weekly testing, so it'd be your individual responsibility to be testing your child in coordination with your school district. School districts might be providing that weekly testing, and it would be the responsibility of each parent to also ensure that they're testing. So again, you need to connect with your local school district to see what level of testing is provided at the school, and or to what degree the district is expecting, or the school, private, public, or charter, is expecting that responsibility from the parent to also test their child.
And we have Jean. Did you say that the treatment of close contacts is different for school children? Sorry, David, I'm going to mute you. That are vaccinated but not boosted, eligible for booster?
In the school setting, the district, school district, private school, or public schools can choose either the close contact and the close contact response, and also the group response. That scenario, those environments have the K-12 guidance that they follow. In a non-school setting, if there is someone that is a close contact that's unvaccinated, they'd be expected to physically quarantine, such as the preschooler that we just talked about, that example. If it's a school-age child that is vaccinated, fully vaccinated, 2 full complete cycles of the Pfizer, 2 weeks after the conclusion of the second one, they would not have to physically quarantine during that close contact time period. So it's nuanced, it's different. In the community, the new isolation quarantine guidance, it's specific. It's very easy to see how that would apply. In a school setting, they'd be allowed to continue to come to school because of the mitigation strategies and then the testing expectation on a weekly basis. So these are changing rapidly. That's why I encourage you also to check back with CDPH's updates, and I walked you through that at the top of the show to help you see how to find when things do change. When they do change, we update the schools regularly, so rest assured that we have a system of communication to all the public, private, and charter schools, and we share that out, and then as well as monthly to the child care providers as well.
Great. And we have Alexandra B. again. What is considered as soon as possible testing for unvaccinated close contact students, and how many days?
Great question. As soon as possible. We looked at it, it's evolved over time, as well as the conditions of the surge makes it a little bit more challenging to get access to testing, as well as sometimes getting the results back when someone's positive has kind of slowed down the process to know when someone was actually technically exposed. That being said, if you have been exposed, CDPH now identifies the 5th day, and this has been the case for many months, that really the 5th day is when you're at the greatest likelihood of being positive, and as well as testing positive if you are positive, as well as being contagious. So the 5th day is really where you need to test on the 5th day of that last exposure. If you have access to testing, in-home test kits, and you find out you've been exposed immediately, like let's say exposed on day 1, if you can test on day 3, day 2, that would then rule out, one, the test results, if it comes back negative, would rule out that you were not positive at the time of exposure. Then again, you'd want to test on that day 5. Day 5 would show if you got positive from that exposure 4 or 5 days prior. So it's kind of a moving target depending on when you find out you were exposed. And again, the 5th day from the exposure is really the most important day to test to see at that point in time, 5 days prior, did you become positive from that exposure. So again, the test is kind of a point in time, kind of like a stop on a train track. It's just at that moment we'll take the test. The 5th day is really the most valuable test to see if you contracted COVID-19 at that point.
Thank you. Managing the mute buttons, and we have it's not a question. Let's see. Is there a requirement to provide proof of weekly testing?
The guidelines encourage the schools would be, let me back up. These are guidelines from CDPH. The guidelines are that weekly testing to continue to stay in school setting during the group tracing. These are guidelines. Here in Santa Clara County, we're following these guidelines. So school districts are working to the best of their ability to work with families to keep track of that. I would encourage you to reach back out to your local school district to see how they're communicating that and how they're keeping track of that. The guidelines are that individual students would test weekly. To the degree they have to keep track of that, that is more of a implementation that each local school district is working with how to keep up with that. But it's not a requirement that they keep all those details. It's a recommendation that they have students test weekly.
Great. Thank you so much, David. And I think we've gone through all the questions. I'm going to give a couple more minutes here as we close up. I know we're here till 3:30, so any last questions for Mr. David Putney with Santa Clara County Office of Education? Thank you so much, David, for providing all those answers and details. I know information changes on a daily basis, it feels like, sometimes on an hourly basis, but I think those resources you provided in regards to the CDPH website will give our audience and ourselves the ability to check regularly and just follow up and stay updated as to what the new information and guidelines might be. If you didn't get your questions answered, please make sure to put them on here on the comments so that we can do that. We are doing our best with what we have. We were, as you all also were, right, scaling down, closing down max vaccination sites, mass testing sites, and I don't think any of us expected this, but thankful that we're still here, David, that our team, was still, even though we were scaling down as well, but we were still here, and that we're able to pivot to the need of the community, doing our best with what we have. So let's see, I have the last couple questions here. And then I have one last question, David, and then what I'll do, and if you can close us up, in regards to any last thoughts that you might have. And then just before I turn it over to you, Susan is wondering, is this going to be posted? Yes, Susan, you can go back and rewatch it here on Facebook or also on our YouTube channel. We have our Santa Clara County Public Health Department YouTube channel where you can also watch the various press conferences and any other videos that we post, so you can watch it again. Let's see, we have Linda Pascual who says, since schools are receiving money for testing from the state, can a district exclude students from individual rapid antigen testing if they miss a pool testing day, especially if they are in class for several days during a close contact exposure?
Students, if they're doing the pool testing followed up by the antigen testing, that was a very common practice prior to the surge. Students would then be expected to test follow up that period of time after, as well as if students are also expected to test between day 3 and day 5 after a close contact. If they're not testing, the guidelines are that they should test within 3 to 5 days. If they don't meet that recommendation, then the guidelines would not allow them to stay in the school setting. So then the district would probably be working with that family to encourage them to test and provide either over-the-counter home test or their testing cadence that they provide at the school. So the school can, the expectation of the school would wait a reasonable amount of time to get that test back. But if it's not being provided and the family's not allowing the testing or providing the testing, then it's difficult for the school to allow that student to continue in the setting. So in past practice, schools would reach out to families and try to see if there's a way they can ensure that student would be tested. There was a question or a comment around childcare. The CDPH did update its childcare. I know it's been since June, I want to say June 29th. We are anticipating that California Department of Public Health will be updating their guidance for childcare in the near future. So please, keep your ears out for that. As well as we have the referral and resources through the Santa Clara County Office of Education that supports in-home childcare providers, and they will provide support. They do webinars monthly or meetings monthly to provide updates and guidance to support childcare. So if you haven't found that, you can reach that contact. Let me pull up the email, and then individuals can reach out directly to our referrals and resources and referrals. Let me pull it up really quick. It's childcare resources, and the email is childcarescc@sccoe.org. Let's see if, did you get that, Karina? Can we put it in the chat? It's childcare, and then SCC for Santa Clara at Santa Clara County Office of Ed.org, sccoe.org. We'll post that. So if you're a child care provider and you need additional help and support, you can email them directly. My colleagues at the County Office of Education can provide that support for referrals and resources, as well as ongoing technical support around COVID-19. They work in relationship with our team here at the County Emergency Operations Center. We're a big team, but they are in a great position to provide that.
So again, can you repeat that, David, slower?
Child Care SCC, that's all one, at sccoe.org. So hopefully that should help our child care programs. Perfect. Thank you, Karina. The email now is streaming at the bottom of the screen. That's accurate. Childcare SCC at sccoe.org. So if you're an in-home child care provider or child care organization, they can provide you some additional technical support, as well as they provide a monthly resource webinar. It's usually Tuesday evenings at 6 o'clock, where they can go over some updates as well as provide other resources for child care providers. So if you're a child care provider, please reach out to our team there, and our team will get back to you and support you. So again, thank you so much for allowing me to be here, Karina. I'd be more than glad to pop in occasionally to help provide some updates. I just want to thank all the viewers today for asking wonderful questions and really being part of the solution. We all need to work together to keep our community safe. And again, we're all in this together. Let's help support each other. Let's have some empathy and compassion for one another and make sure we're taking care of our local communities and our children.
Thank you so much, David. And I just want to add to this. We are proud to collaborate with Create TV beginning today, and they will be also streaming this on their pages, social media pages, as well as their channels. So thank you so much, Create TV, for partnering with us to do our best to get as much information as we can to our community members, our residents of Santa Clara County. Let's remember, stay masked, stay safe, stay home if you're feeling sick, get tested if you can. If you can't, then continue to stay home until you can. And, let's do our part to end this pandemic. As, I have faith. I know we've done, I feel like we've been at this point before, we've done it before. And I know that we can do it. Each of us putting in our grain of sand, as they say, right, to ensure that we see an outcome, that we all are a part of this county. Doesn't matter where you live or what school you go to or who you work for or where you shop. We're all a part of this county, and we get to do our part to be safe. Thank you so much. Thank you again, David, for all you're doing, and all Santa Clara County Office of Education and all school staff. I know we're all working overtime. And it's not easy. It's not easy, but especially those that are taking care of our little ones at the front lines, whether it's childcare in the classrooms. Thank you all, not to mention the nurses and let's do our part to help out and ease that stress level that we are all feeling in one way, shape, or form. Thank you again, David, and we will for sure invite you back again. I know there will be an update to schools, in the near future, so we're always glad to have you on here. Thank you, everybody. Stay safe, and we'll see you in 2 weeks again.